Welcome, Sreeram, to the podcast. Um,
Thank
thanks.
you. Thank you so much.
Yeah, really excited to chat with you because you are working at a tech nonprofit in India that is reaching millions of people, and you are one of the founding engineers. So you have been there since the beginning, and you have a
Yeah.
good context on the landscape as well.
Yeah. 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 Thanks for having me. Yeah, it's been a fun journey at Noora. I joined as I think it's funny that you say that we're a tech nonprofit because when I joined, they were kind of like Noora's like 12 years old now, and when I joined them in 2026, sorry, 2020, it's 2026 now. So I've been there for about 6 years. When I joined them in 2020, it they were just starting out their digital program at the time. I think they had a very early team that was not super technical, but then had set up a WhatsApp based intervention that could work for patients and caregivers. And now to kind of be known as a tech nonprofit is quite a journey I think we've had. So yeah, so I just found that funny. But yeah, thanks for having me.
Sure. Yeah, I'm keen to learn more about that journey as well. Do you mind explaining to the audience a bit about yourself and what Noora Health does?
Yeah, sure. So I studied engineering, not computer science as usual. Studied mechanical engineering. I was always into robotics, and then got into programming. So I worked in like a fintech startup at the start of my career. So I worked initially at the Indian Institute of Science. I had a whole plan of kind of like going abroad for my masters and studying robotics and so on and so forth. But then I kind of got this opportunity to work at a fintech startup, and that was also super exciting. And the Indian startup ecosystem was kind of evolving there. So I joined as their first engineer, their first hire, and kind of like built a fintech product, built the team from there. And that was a fantastic experience. But at the same time, I was also volunteering at this organization called Make a Difference. And I was really interested in the impact space. I was looking for an opportunity to kind of like bring in some of my technical and engineering expertise from my previous work to a nonprofit sector. And Noora was kind of like a lucky break at the time. And also, the world was kind of going through a pandemic and so on. So public health was on everyone's radar as well. So I kind of took a chance at that time. I was not, expecting, I think, kind of the engineering side to kind of like blow up in this way. So I joined them, worked there for a few years. And then I think as more and more people joined Noora Health itself, like the tech aspects of our product also started getting more and more attention. And yeah, and now we are across like 4 countries now and expanding to more and trying to offer kind of like what Noora Health does as a product and so on. So it's been a fun journey, and we've also been very lucky in a way to kind of be at the right place at the right time. And also, we were the digital side of Noora Health took off at a time when WhatsApp was also becoming really popular in India. It was kind of becoming like the default app that everyone chatted on, and so it was kind of at the right place at the right time. And now we're kind of a global digital health product.
Amazing. And could you explain, just in a few sentences, like what Noora Health does and what is the tech side of it?
Yeah, for sure, for sure. So Nora started off as a training program for patients and caregivers. So typically, people who come to hospitals at the time we were only in district hospitals. People who typically come to district hospitals, kind of travel from far, and they usually come for some sort of major medical incident, either some sort of surgery or chemotherapy or child delivery, which is even today our biggest use case. So there was a lot of people travel from afar to come to come to district hospitals, and they leave without much face time with the actual doctor or the actual medical practitioner in the hospital. And they typically when they either get a surgery or they have a child delivery, they're usually in the wards. Kind of interacting with nurses, interacting with the other healthcare staff in the hospital. So the idea behind Noora Health was, can we use that moment as a teaching moment where nurses can actually train patients and caregivers on what are the best practices to do at home once you leave the hospital. So that was the original idea. And for the longest time, Noora Health was an in-person only program where these training sessions used to happen across hospitals, initially only in India. Um, and they would be what Noora Health would primarily do was essentially train healthcare workers who would then go on to deliver this training in the actual hospitals. So what happened around 2020, actually a few years before that itself, when they were piloting the product, the idea was that a lot of patients and caregivers themselves kind of voice the fact that once we leave the hospital, we kind of like, don't lose touch or, kind of forget a lot of what is taught. And it is also emerging from the field that, once, this training program can only do so much. How much can someone learn when they're in a hospital or, when they're in a medical situation like that and recovering in the ward? So the idea was, can we get them onto some sort of digital platform where we can continue kind of the learning process through nudges and through kind of having an interactive interface like WhatsApp, for example, where you can ask questions, you can receive messages, and so on and so forth. So that's where the digital side of Noora Health comes in. So fundamentally, we are a WhatsApp and IVR based remote care program where people essentially sign up when they come to the hospital and attend our in-person program. And then they receive like health nudges on WhatsApp. And because WhatsApp is also like this conversational two-way interface, they can also receive responses from us. So they ask us medical questions, they ask us doubts about their recovery journey or their just general health journey, and we have a back office team of nurses and doctors who kind of respond to that entire system. So the entire technical infrastructure behind all of the nudges and all of the the onboarding of users from these facilities, the response that goes out, all of that is essentially where the engineering and the tech team of Noora comes in.
Great. And the significance of Noora Health is that it leverages a sick person's close family members to provide
Yeah.
ongoing care.
Exactly, exactly. So that was the core kind of philosophy around which Noora Health is, consolidated. And, it was the idea that we started off with, and that belief has just become more and more strong over the years, which is that your immediate family caregivers are kind of the biggest lever in anyone's health journey. So if we can empower them, that can kind of lead to the best outcomes in patients' lives. So we initially started off by training them in person in the hospital, and now kind of continuing that journey onto digital platforms. And now with digital platforms kind of being everywhere, it makes sense. And the biggest signal for this is that so many other players have now gotten into the space of having a WhatsApp bot, having some sort of chat interface to help nudge people the right way. I think so. Yeah. So that's kind of where I think our belief is, in that if we are able to empower patients and their caregivers with the right info, they'll be able to have better health outcomes.
Amazing. And I believe that now Noora has reached about 10 million people and caregivers across multiple countries in Asia.
Yeah, yeah. Our in-person program has reached close to 10 million people, over the entire span of our history. Our digital service, which started in 2020, has reached about 2 million people now. And it's only growing more and more because, I mean, apart from our in-person sessions, which was previously our biggest channel of, getting new users, we've also started partnering with governments now, and, to kind of get some of the health data. And, all of, India, especially like with you must be seeing and reading about all of the digital health initiatives that the country is taking. So there's a lot of data about citizens, health data about citizens that the state already collects. So if we can kind of tap into that data and onboard users onto this platform as a way to kind of lead better, healthier lives, that's something that we're exploring. And so that is also kind of expanding our reach to much more than 2 million in the very near future. And the hope is that this Nural's vision, the ambitious articulation of our statement is that this becomes the standard of care where, this becomes like the default that anyone has whenever they have any sort of hospital visit or healthcare visit, where they have a digital companion by their sides.
Brilliant.
Yeah.
Could you expand a bit more about what the government is trying to do? You mentioned that they collect a lot of health data, but are they also very like technology focused and very forward thinking in terms of partnering with NGOs like Noora?
Yeah, for sure. And, this is a bit of a double-edged sword, right? Like, because, obviously the Indian government, I'm just giving India as an example, but, nation states around the world and governments around the world are rallying around this point. But everyone wants to do digital transformation, and that's a good thing, right? Like everyone wants to put more digital services in the hands of their citizens and make it more and more available, and so on and so forth. But the flip side of that is that there is a lot of um, you know uh, technocratism that's kind of like pushed by the government, where a lot of data collection and a lot of burden on healthcare workers comes up because of this extensive data collection. So yes, so there are both sides of that coin that we have to look at. There is advantage in the fact that governments are very tech forward and want to digitize a lot of information, collect information about their citizens so that they can help them out and so on. But the other side is, of course, that this collection comes at the cost of a lot of healthcare workers who are on the field, doing a lot of repetitive data entry stuff just so that the government can, have this information to then kind of be able to do something about it. And now they've started doing something about it, which is good. But yeah, that's the other side of the coin. And this is, of course, not to mention all of the security concerns that come with India, but that's more about state capacity and so on. Like all of the Aadhaar leaks and the healthcare data leaks that happen. That's the other kind of like bad side of the government collecting a lot of data. But that's kind of like hopefully something that will improve over time as the state gets more and more better with like storing our information and all of that stuff.
So the top-down approach downside is that healthcare workers are now having to use like 5 or 10 different systems just to do their job.
Yeah, exactly. I mean, so like there are like horror stories from the field where ASHA workers and ANC and A&M workers, on in the field are literally filling the same piece of data in multiple applications. And that's something that even Noora has actually had some sort of experience with, because as we deploy our program in the field, there is some amount of data collection that we also need to do. And so, like the first solution that we jumped to as an organ as we grew was to have our own app, and that became yet another app that healthcare workers now have to use to fill up data about this new random program that Noora Health has, and they couldn't care less. They're just like, hey, this is just another data entry that we are doing, and that's understandable. So we've started with that approach, and now our thinking has slowly shifted more and more towards trying to integrate with existing government monitoring systems that already are there. An example is in Andhra Pradesh, for example, the state already has an app. It's like a super app, yet another super app, which is a conversation for another time. But they're claiming that it's a super app to end them all, and it's one app where you enter all of the information, and we are trying to get in our monitoring within that app. So that's a lot of like government liaising and partnership building and stuff like that, which kind of happens, in the back burner. But you're absolutely right. Like the downside of the technocratism is this data entry burden, and it's just this the kind of the machine sometimes is very brutal. Like they end up facing so many app errors, and they don't get their incentives or their payments on time because of that, and they don't have anyone to complain to either. So yeah, so I think that there are definitely downsides to it, as you rightly said.
Interesting. So whilst a traditional tech company might be focused on pushing out, new features every quarter, and that's their marker of success. For Noora and
Yeah,
other tech
yeah.
nonprofits, it's probably more a focus of like a systems thinking approach. Like, how do you work with existing systems, and instead of like competing, you're not like competing in the free market. You're actually working towards the same goal.
Yeah, yeah, absolutely. And that's kind of like the core difference, I think, in a nonprofit and a for profit or a typical tech company, the incentives of the two companies, right? Like a tech company is kind of focused on revenue, and that's a noble goal, and that is what businesses are for. So fair enough. But when it comes to a nonprofit, I think you're looking at much harder metrics to measure, actually, right? Like it's much easier to measure revenue because it's just a number that appears on your bottom line. But impact is so multifaceted and complex, and now you have all these RCTs coming up, which are one way of measuring impact, and we have different kinds of research studies that have come up over time. So impact is a much more nuanced goal, and a much more like harder kind of like goal to achieve as well. So as virtue of that, nonprofits do need to be a lot more thinking in systems, thinking in how can we integrate with something that is happening at population scale all the time, whereas a for profit is governed by different incentives at that scale.
Great. Um, I know you have a controversial take on why the concept of product market fit doesn't apply to tech nonprofits or tech for good as much as it applies for for-profit companies.
Yeah, I mean it's a hot take in the sense that I think product market fit is a term that is very aligned towards like how for-profits work, where you assume that there is some sort of like demand for a particular product, and you assume that customers know best. And if there is enough need for it, then that's the only way to kind of like continue building it and make sure that you have validation and so on. And I think like when it comes to impact organizations, it's not that simple, in the sense that like a lot of the time, for example, if you talk about Noora Health itself, right? Like a lot of the information that we give patients and caregivers is really not, demand driven. In fact, the demand is quite the opposite. There's a lot of quackery, there's a lot of pseudoscience, a lot of WhatsApp University stuff going around, and so it's like it's a different. It's almost like a push where kind of harkening back to like this technocratic approach that you were talking about. It does rhyme with that to some extent, in the sense that we are pushing something that we believe people on the ground need, even though they themselves might not necessarily realize the need for it, and might be happy kind of following their family physician's advice or their local quack's advice and so on. It is it's always like driven by the fact that we are always impact focused, and that's kind of where I think orgs have to philosophically agree that impact at the end of the day is the ultimate metric. And like I was saying, right, like a PMF is easy to measure, right? Do you have revenue? Are you making enough revenue to kind of like be sure that you'll be able to sell more? Are you making a profit, so on and so forth? Whereas impact is a lot more layered. It's like, how do you judge like the effectiveness of one random intervention amongst the many other things that are happening to you as a human being, right? Like for us to like measure our WhatsApp intervention is like saying, we are measuring this one WhatsApp channel that is sending you information, and we're trying to see if that alone somehow makes an impact in your life. And so it's a hard question to answer. There's I think there's this really nice metaphor that I love, in the policy world, where it's when you talk about measuring interventions and measuring like impact of a particular intervention or a product or whatever it is, doing it in like in society, when you have like independent agents like beings, is like saying that you have like a pond, and where you have constant like raindrops rain patter happening, and you basically like drop put a drop of water there, and you try to measure, did that change the actual surface of the water? So it's like near impossible to measure something like that. But we have some tools. We have RCTs, we have pseudo random trials that happen, to kind of like measure the impact of these interventions. But it's hard work, and like PMF in my mind is like a cop out, because it, I think, comes from a different kind of framework, and I don't think impact organizations can go with something like that. To build their tech product, it has to be underscored by impact at the end of the day.
Great. Amazing. Yeah. So I guess, yeah, like these frameworks like theory of change have been around for a long time, and they're probably
Yeah.
more relevant.
Yeah, absolutely, exactly. And there's a reason they've actually taken so long to like evolve and come up with, and they're still pretty abstract if you ask me. Like if you look at a theory of change framework, you'd be like, okay, I don't know what to do with this. And then when you actually start thinking about your intervention, applying some of the ideas, that's when you slowly start to understand, kind of the complexity. So yeah, like you
Mhm.
said, theory of change, impact evaluations, making sure there are things like outcomes versus outputs versus outcomes, where outputs are just like kind of materialistic, measurable, kind of deliverables that you have of your intervention, and outcome is whether actually delivering that push the needle or not. So it's like knowing whether a free meals are happening at a school versus knowing whether those meals actually help, and that's a very nuanced distinction, right? And it's something that a lot of organizations also struggle with.
Yeah. I remember hearing this story about the Against Malaria Foundation. They would give mosquito nets to people, but some unintended consequences happen where some farmers will use the mosquito nets to try and do fishing in ponds.
Oh, oh wow.
And then because the nets have this poison in them, it ends up killing the wildlife in the pond.
Oh geez. Yeah, yeah. Talk about unintended consequences. Yeah, yeah. This is exactly the kind of stuff. Like it sounds so intuitively right to say that giving mosquito nets prevents malaria, and I'm sure, and I think it was also. I think it was even brought down to us saying that this is what it costs for a malaria net, and this is how many lives it saves. But then looking at it systemically is when you think about all the knock-on effects that happen.
Yeah, yeah. And I know that you recently spent some time in Indonesia to actually
Yeah.
expand the program there, but also like understand how people would use a tool like Noora Health in that context. Can you talk
Yeah.
a bit about that?
Yeah, for sure, for sure. So we actually are getting a lot of interest from Indonesia, specifically for Noora Health, but in general also, for digital tools that can be used on the field for community care. So I think it's a variety of different factors. Like, it's obviously the tech revolution that's happening around the world. More and more people are online, and it's making more and more people are digital natives now. And, people who are born, in this generation are like plugged in from day one, and versus people like us who grew into the internet, right? Internet and like the digital world in general. And it's also in general, I think the Indonesian leadership is a lot more tech forward now. Their Minister of Health is very tech forward, is pushing a lot of digital health interventions in the country as well. So I think it's a combination of all those factors, and we were lucky enough to be one of the people to pilot our product in one of their regencies. It's called Banyuwangi. In the map, it's the one that's right next to Bali in the mainland. So Bali is like an island. This one is just the regency that's just adjacent to that. And we are launching a Nura Health digital intervention there. Essentially, what our intervention is essentially, if you remember, I spoke about how patients ask questions, and we have nurses and doctors, that are employed by Noora Health responding to those questions. So we're trying a slightly different model here, where the healthcare workers that are, employed by the state, by the local government of Banyuwangi, which is the regency where we're piloting it in, they are the ones who will now be responding to patient queries. So we're getting them to use some of our tools, some of our healthcare worker facing tools, getting them trained on using them, fixing some of the issues that came up with them, and so on and so forth. And that's kind of what we're doing there. And we're hopefully going to be launching by, I think, by towards the end of this month or mid of this month. I think it's going to be a pretty big launch with a lot of big people there, because it's they're also there. I think ministry is also excited about more and more digital health interventions. And yeah, and I think my biggest takeaway, honestly, more than what we do at Nura Health, was just seeing the community health uh, program, or just the community health system in Indonesia. It's so decentralized, and so every local health agency is so empowered to kind of do what they think is best for their citizens, and the healthcare workers are so motivated. They have these things called a Puskesmas, that's like equivalent of like a primary healthcare center in India. But imagine like a primary healthcare center in India of the future. It's like basically the size of a hospital. Every table has a computer. Healthcare workers are very digitally literate. All of them are in, like, already chatting with the people that they care for through some sort of digital tools. So it's a lot of just to say that, like, a lot of the work that we do is also standing on the shoulders of giants, right? Like, it's standing on the shoulders of existing systems that are have been developed over years, and digital is just that unlock that kind of like just supercharges it a little bit, perhaps. And to me, that was like my biggest takeaway. And like, I think how much ahead as an Indian, like looking at the Indonesian health system, and I was like, man, we have a long way to go. And yeah, a lot of things to learn from our neighbors.
Yeah, and Indonesia is good because like it's like a small case study, even though it has a population of over 200 million.
Exactly. Exactly. It's so dense. It's almost in parts, I think, more dense than India. And yeah, and they still manage to not have a lot of the same evils that we have. A lot of our evils are to do with government and over centralization. I think they've had different kinds of challenges in their history, but then over centralization is not one of them. Like, every, I think, city has like a mayor there who's like super empowered to do stuff. Whereas in India, like, I don't even know who the mayor of, actually, there is no mayor in Bangalore, come to think of it. We haven't had elections in like 5 6 years. So yeah, so it's a lot of like state capacity differences between the two.
Right. Yeah, and I think with India historically, just for the audience who may be outside India listening to this, I think India is a bit unique because there's like competition between states. So
Yeah,
maybe a country like Indonesia doesn't have that much of a problem But
It
yeah,
actually has a lot more competition, if that
oh,
makes sense. Like, yeah, they actually, I mean, it's healthy competition in the sense that they actually, all the different regencies have, compete for, like, like the most number of like lives saved, or the most number of, deliveries that have been, successful and have not led to a complication. They have all of these metrics. And, when I went there, one of the health centers there had gotten like a scooter. Which they now use as like a medicine delivery, like a pharmacy, but like a remote pharmacy. And they were like, they won it because they did the best in some sort of metric defined by the central government. So it's a lot more healthy competition there. And it makes sense because there each local government is empowered to do what they want, and so they truly are accountable for like the outcomes that they have. Whereas in India, I think, like, yes, there is some amount of competition between the states. There's no uh, debating that, but there's still a lot of central oversight, and a lot of like approvals that you need to get from the center to push the needle in your state. And so much of it is controlled from Delhi, metaphorically speaking, right? Like, and it's so yeah, so I think it's a lot of that. So we definitely have competition, but we have a long way to go, compared to, like, how I think, in my perspective at least, I think Indonesia is a lot more decentralized that way, at least their health system, compared to like how it is in India.
sure.
Yeah.
Um, can you talk to me a bit about the tech side of things? I know you're an engineer, so I'd love to get into the juicy details.
Yeah. Nothing like an engineer. And I can go on and on about the tech, so you'll have to stop me at some point. But yeah, so I think, like, our I can talk about, I think, on a high level, one thing that Noora Health decided to do from the start is invest in in-house tech competency. I know it's common now, but I think it was perhaps a little bit of a new thing, back in 2020, where I think even at that time tech was still largely outsourced, done through like other service companies, where they would build an app for you or build a platform for you, and basically like engage as a tech vendor. And that worked, and is definitely, like, I think, something that nonprofits, not that they chose to do it, they really were financially constrained, and tech talent was always expensive and always hard to come by. So that way Noora Health is also lucky to have the right funding. But I think investing in a tech team really paid off, because now we have a 15-member engineering team now, and we can basically build as fast as any sort of like emerging startup. So that gives us a lot of flexibility and a lot of agility in how fast we're able to move. And now with AI tools and the direction that coding and programming is taking, having a 15-member engineering team with Claude is like a 100-member engineering team at this point.
Wow.
So it's like, yeah, I mean, that's obviously an exaggeration, but
Oh
you know
yeah,
what I
sure,
mean.
sure.
Like, it just multiplies the impact of an individual software engineer. Whereas if we were working out of service contracts, service contracts are still being charged based on the old system, right? Like, now
Mm.
it's trivial to build an app. You can prompt Claude to build an app for you that works. Whereas now companies will still charge you lakhs of rupees to do it, because the market still hasn't fully adjusted to the fact that building has now become super cheap. But now that we have in-house engineers, also, and just by virtue of the fact that they're working at a nonprofit, they're also very motivated by solving for the problem. So I think that really like put us on this right path. Anyway, the reason I was heading here is that I think, like, Noora, we've been lucky to kind of ride the wave of tech as it expanded in the country, with a lot more like nonprofits deciding to build in-house competency rather than and a lot of like tech nonprofits, where nonprofits are literally building digital products, right? That was pretty new when we started back then. Now it's much more common, with Adalat AI, Rocket Learning. So many of these tech nonprofits have started in India. So we were very lucky that way, and I'm glad we invested. And when we started off, and we're 50 members now. Until last year, we were about 6 or 7 engineers, and we've just kind of like expanded our team, just given kind of like how fast we're able to move with a lot of these different states in India, and like in the different countries. So our tech stack was, originally, because it was just me in the start, and I was most familiar with this framework called Ruby on Rails. So all of the stuff was built on Ruby on Rails. Our initial platforms are all Ruby on Rails. So the initial few developers were sort of had to adapt. And Ruby on Rails is not, Ruby as a language is not that popular, I would say, compared to like a Python or a JavaScript, or what have you, like these more popular Go, you have Go and Rust nowadays. But Ruby was always like, it was like a contender. It had its fan base, but it was like a little bit of a a niche language not as common as Python. So a lot of the initial developers had to learn Ruby, get up to speed with me to kind of contribute to the code base. But the good part was that as we got more and more, and as we hired, we realized that Python by far has the biggest kind of pool of engineers for us to hire from. So we made like a hard decision to say that, okay, let's move all of our entire stack over to Python. And I was also, I knew Python, but I was certainly not as familiar enough to, build a platform on it and actually be accountable for it. So that was a big upskilling curve for me as well, where I learned Python, sat with the engineers, sometimes made really stupid mistakes that, my engineers pointed out to me, learned along the way. And now I think our entire tech stack is on Python with JavaScript and React on the front end. So we've tried to, like the one good thing about being a nonprofit is that, we, like we're very cost constrained, obviously, right? Like, even though we are able to hire tech talent, etc., like the pool of resources is not infinite. So any software tool, anything additional that we need to buy is something that is, will be questioned and rightfully so. Like it should make sure that, anything that we buy or any new software that we use is something that is actually truly justified. And like because we are a nonprofit and because we have our own tech team, we've really been able to leverage open source tools that are out there for so many of the use cases that we have. And again, like going back to my point about standing on the shoulders of giants, really we wouldn't be here if it wasn't for like the open source tools that we were able to use, and the open source community in general, like who put these tools out there for orgs like us to use. So a lot of our stack is based on open source tools. We use this open source tool called Rapid Pro for our campaign scheduling. We use this other open source tool called Sentry for observability and monitoring. We use Langfuse for our AI stack. So and I can go on. So like I said, like I think a lot of our stack is built on open source tools, and with Python as kind of like the primary language that we develop in. And we have we have an Android app and a App Store app. Like the Apple App Store app that is used by our healthcare workers. And that's also, we went to this framework called React Native, where you write code once and it builds an Android app as well as an iOS app for you. Otherwise, like traditionally, you have to have an Android developer, an iOS developer, maintain each code base separately, and so on. But we've gone with React Native as a framework again because we had to be frugal as a nonprofit. And React Native is like honestly like other than very complex kind of rendering use cases on your phone, it works pretty well for basic apps. So we've been very frugal and very like mindful from the start of like costs and being a lean team. And that also like shows in kind of like the size of our team. Like we by far have like the smallest team if you look at like the other tech nonprofits that exist that are primarily building a product, right? Like their primary intervention, for example, Adalat, Rocket Learning, Digital Green, all of them started off as a tech product. Whereas Noora is like growing into sort of a tech nonprofit, like you put in the start. So our teams have always been lean. They've always been multifaceted. We've had like a very strong team from the start, which I think has been, I think, my biggest, fortune and like the best experience that I've had, like working with the engineers on the team. So yeah, so that's I think a quick brief on our stack. We are very open source heavy, and like the goal is always to at some point hand it over to a state government or hand it over to a district government and be like, you run this. And we need to avoid proprietary softwares there. So the impetus has always been that. But yeah, but that's how we've been thinking about engineering and thinking about how we build our stack. I know that was a little bit all over the place, but yeah, I hope that was helpful to understand.
Yeah, that was great. Actually, I want to go a bit deeper. I want to also ask you about AI. I believe that you're
Yeah.
using you test out different AI tools.
Yeah, for sure. I mean, there are different AI tools and different AI models. So, like as I mentioned, like as part of our model, we do have patients and caregivers asking us questions, and we have a team that responds back. So initially, as you can imagine, a lot of the times people are just saying hi, or people are responding to some nudge, or people are doing some sort of I think like not necessarily asking a question is what I mean. So out of and just to put numbers to like that statement, as of today we get close to like 10,000 to 12,000 incoming messages a day, and only about 10 to 15% of them are actually medically relevant questions. which is like, things like what do I feed my, how do I breastfeed, or what do I feed my child, or what do I feed my diabetic father, things like that. And so initially there was a lot of manual triage happening, where our frontline health healthcare workers were actually manually reading every single message and then deciding whether it's medical or not. And once ChatGPT and all of these LLM tools came, it became pretty obvious to us that like a classic use case for this is some sort of triaging mechanism where with natural language understanding, um, although caveated on the fact that it's mostly English and we operate in regional languages, there are some gains to be had here by actually having an LLM triage a system and then having a human just verify that, rather than having a human read every single incoming message. So that's how it started. And now, AI generally powers our entire response system. So the healthcare worker who's responding has like an AI tool that gives them the user's medical history, like their entire chat history, the other questions that they've asked in the past, the details, any medical information we have about them. Like I mentioned, we get some amount of information from the government, and that usually contains things like how many ANC, how many antenatal visits have they done? Are they at risk, and are they a high risk pregnancy? Or if they have diabetes, like what's kind of their medication history, what have they been diagnosed with in the past, so on and so forth. So our healthcare workers now have our the frontline healthcare workers now have an entire suite of tools using AI and LLMs primarily to just kind of like best answer a user's question. So one was like the triage side where we look at the most high impact conversations that a healthcare worker can actually have. And two is like within that conversation, can we make it super engaging? Can we make it the best possible interaction ever? And that's where like I think AI comes in.
Amazing.
Yeah.
And with AI, sorry, with languages, you mentioned that you serve regional languages. Has AI been involved in that, or is that
Yeah,
just
yeah.
something?
It has, and we try to use a bunch of so we essentially translate all of the queries that we come like under the hood. Essentially, what's happening, like it's a little bit more complex than what I'm explaining. But if you had to like break it down into like explain like a five situation, it's essentially the whatever query the language comes in, we have a translation that converts that into English, and then we have a golden like a golden set of like questions and answers, a golden set of sample messages, and whether they're medical or not in English. And then we use AI to kind of like categorize that, and then we have an outcome. So that's how we started. And then we realized that having this translation step is actually something that might lose information. And at the end of the day, you're just kind of like pushing your load on this translation machine at the end of the day. So we started having multilingual knowledge banks, multilingual sets of data to kind of like help these LLMs better detect like what is a medical query, what is not, and so on. And we found some sort of success there as well. But the jury's still out. Like we still use we've not been able to test. We have been able to test different models, but tests can be infinitely deep. So much of it relies on the prompt, so much of it relies on how you what sort of ground truth you show the model, and so on and so forth. And there is a lot of iterations that we can do there. But broadly, we've kind of tested like different providers, and right now we are using OpenAI for our for all of our AI use cases in the backend, and we use Gemini for voice. Because that's something that we found to be very useful, along with this Indian startup called Sarvam, that's supposed to be really good with Indic languages. So we've been trying all of these different tools to kind of like support this multilingual nature of our system, because I think that's our biggest, advantage and the biggest challenge. Because all of these LLMs, a lot of these like foundation model providers, at least that those that come from Silicon Valley, are very English focused, or rather European language focused. And having something that works for Indic languages, like for example, all of the languages in India, Bangladesh, Nepal, etc., as well as languages like Bahasa, Indonesia, which are also, relatively don't have as much corpora as English, for example. Bahasa is still fine because you have close to like you have a lot of people speaking it, and you do have some amount of text corpus data. But in India, there are languages that have almost nothing. So that's where the real challenge is, and I think our biggest opportunity as well.
Awesome.
Yeah.
Um,
Yeah, and I mean, this is also sorry. I mean, I just
yeah,
one
yeah.
thought that occurred to me is like I think and what I forgot to mention was just how AI is changing the way we work. So, like I was saying, I was just briefly alluding to it, like just sometime back where we're talking about, AI coding and how coding has changed. And so that's another major unlock that AI is having within the organization. Like it's changed the way we code, it's changed how fast we ship. It's changed how fast we iterate on a particular feature because writing code has become super cheap now. So we've had our phases where all of our developers initially token maxed, and brought on big bills, and then now where everyone's kind of like learning to manage their context windows and get better and better output from the LLM. But yeah, but I mean, like it does. I mean, at this point, I'm probably sounding like a broken record because Silicon Valley has been promoting this for like many years, but it really is, I think, like irreversible like change in how we code and how we think about writing code and building applications. Yeah, it's. I mean, I'm not going to be like alarmist and be like software engineering is dead and stuff like that. I think software engineers have a lot more impact now. But it really has completely transformed, the way we work and the way we brainstorm and like I think in general build things.
Great. Yeah. Naval Ravikant says that um, software engineering is the new product management, and um, being an AI model tweaker is the new software engineering.
Yeah, I mean, yeah, I know Naval, and I read some of his stuff. I think he tends to oversimplify things a little bit. And again, this is probably because I'm a software engineer, so I'm on the inside, right? And so when he has like a take on finance, I'm like, oh man, that's so smart. But then probably someone in finance will be like, dude, that's just a load of shit, So I get where he's coming from. I do want to acknowledge that like the job is fundamentally changing. And people don't you don't write a function by hand anymore. You don't write scripts by hand anymore. And like so there are like what he's saying rhymes for sure, where a lot of what engineers used to do now is kind of being done by the bots. So engineers have to move to higher value tasks, and that is right now what product managers are doing. But I just believe that roles will get shuffled around, and product managers will probably like be called something else. Software engineers might eventually be called product managers or whatever. But I just think it's like a change in the role, and I that is something that I'm fully on, like on the same page as him. Where I don't think like people are going to be writing code by hand, or there'll be a very like select few like small people who will do that and whose job it is, as it has always been. Like who knows assembly code? I'm sure there are like probably like a few thousand beings alive right now who can like understand and work on assembly code, and we're okay with that as a civilization. I think it'll be something like that, with code, with I think like writing Python and stuff like that tomorrow as well. So yeah, I hear him. I think it's gonna be interesting to see like how the space evolves. I think that's the other exciting part of working in software and digital right now, is like it's completely changed the way you think about building writing software. So, it's like an existential crisis on a day-to-day basis.
Oh my God.
Yeah.
So, given that um, the barrier to producing code has reduced a lot,
Yeah.
and the access to compute, the access to talent as well. You've got, I think, started as like a Stanford school project, and it's able to hire these IIT people from like its early days. Um,
Yeah.
does that mean there's potential for impact tech companies and tech nonprofits to be able to scale much quicker than they could in the past? Or do we still have these challenges around um, governance, around making sure, you know, outcome versus impact and like government partnerships?
Yeah. Yeah. I mean, that's a good question. I think like I definitely think that the people's imaginations have been unlocked now, and people are entertaining the possibility of a nonprofit or an impact tech product more and more. It's getting more and more normalized now. So I think that's a good thing, and so that definitely opens up possibilities for more players in the market, more people to work for these products. Something that was very like very for profit heavy just because of the cost and kind of the learning curve of that particular talent. Now that is like kind of collapsed, right? So So I do think it's like an exciting time for tech nonprofits. They can definitely hire more, and more of them can exist, and hire top talent, like you were talking about, and build great products. But yeah, but I do think that like the scale, like I was saying, right, like governments are more and more optimistic now about tech. They want to make sure that their own departments are more tech forward, as well as their citizenry, by all of these digital interventions and ideas that they're pushing forward. So I think there is more impact for scale. But then again, like I said, I think all of that needs to be underscored by impact at the end of the day. Because there's always there's always going to be a hype cycle where when there is an opportunity, and when there is a particular problem to be solved, many people will to solve that problem. And I would argue that that's where we are at right now. We are at a like overabundance of like digital technology, where like I was saying, these overwhelmed healthcare workers are entering attendance data everywhere. There's so much talk about us being glued to phones. I think we are at a little bit of a point where there is a lot of technology, and so that's why the market is so wide as well. So we'll probably reach a point where we're like, okay, which of this technology is actually impactful, which of these technologies are actually moving the needle, which of them are necessary, which of them are like just good to haves, and what are the trade-offs. There are huge conversations about whenever you talk about digital, talk about the information age and talk about digital stuff, privacy is always the first concern, right? Like you are trading off privacy at the end of the day. Google knows everything about you, but you get a lot in return. So we we've right now made that trade-off, saying that okay, I'm okay with this, but who knows what's going to happen. So that way, I think there is a lot of potential for nonprofits to scale and build good products. But I just hope that they are underscored by impact, in everything that they do. And it's hard. It's not easy. It's easy for me to say this. Noora itself has struggled. We failed a lot too. We've built stuff that we realized that is actually counterproductive. So it is a tough journey, but I think like, yeah, now hopefully orgs will have like the luxury of time and money to have that journey.
And yeah, it's great. That's really great. Um, yeah, well, I think that's the main questions I wanted to ask really around what Neura does, how you measure impact, the tech. Is there anything else that you wanted to add?
No, I think nothing else. It's an exciting time. I would encourage people to lean into, especially if there are software engineers listening to this, or people who work in tech. I would encourage you folks to lean into AI, lean into kind of the new tools that are there at our disposal. And yeah, and there are many exciting problems to be solved in like the impact space using technology that might not necessarily have a market solution there. That might not necessarily have someone who's ready to pay today, but there's so much that can be done, and many organizations doing great work in India, Bangladesh, Indonesia as well. So seek out these organizations if you can. I promise you, like it's exciting work, and you will get to be like at the forefront of a lot of digital innovation. So yeah, I'd encourage folk to look for impact tech roles, because I think that, like the impact space needs good tech talent. And it's like a stereotype, how we talk about like the best talent goes to Wall Street, or goes to like the stock market, or goes into finance. I'm hoping that some of it gets redirected into the impact space. I think we're much in need of that.